It's like, I feel great, doc. You know, I have no pain, but why are you tilting? I've never been accused of going too easy. It's usually, it's also, I've never been accused of not talking enough. And, if you want me to be quiet, the visit costs double. And it's discounted if you let me talk. Relax here. There you go. You okay?
Yeah.
I'm getting out of here. Kind of weird. I suppose they weren't going as hard as this, huh?
No.
Yeah, okay. No, Ed.
You're doing a pretty good job.
Okay. Tilt to the left for me. Okay.
Okay.
That's, the other chiropractor didn't do that, okay. Okay. Tell me about what happened. You had a car accident in 2018?
Yes.
And describe that accident for me. What happened?
I was rear-ended twice. Like, it was a double hit.
How fast were they going approximately? Were you stopped?
I was stopped, and they were probably going, like, the first car was probably going about 30, and the second car was probably going around 60.
Wow. Okay. And describe what you felt after that accident in terms of symptomatology that you originally went to. You went to a chiropractor for that. Mm-hmm. What were you feeling?
Like a lot of tightness and it's really tight. My neck doesn't move very well.
Okay.
But when I get extremely stressed, like I can feel it. Just I call it my hump right here.
I understand. I got you.
But I could just feel it. Just horrible pressure.
Okay. Did you notice that from the accident, like you lost a lot of range of motion after the accident, or did you feel like you had stiffness before the accident and it just made it a little bit worse? Or?
I think it was definitely after the accident.
Okay.
And then right after I had my surgery as well, like I felt like my arms just still fully don't move the way that they should.
Okay.
Like they're tight.
You had a double mastectomy. This was right after the accident?
Yes.
And how did you find that yourself, or how did that go about?
It's just a normal, checkup visit,
mm-hmm.
and I felt like something wasn't right, and my doctor said, let's try to get you in for a mammogram, and that's how it was found.
Okay. How often do you have headaches? Has that gone up since your accident? Or
definitely went up since the accident.
Okay.
Probably at least 3 times a week. When I feel more stressed, probably more than that.
Okay. When you were talking about your shoulder pain, is it more up here on the upper part of your traps, or how about in between your shoulder blades? What would you say is?
I would say more on the upper,
okay.
But I would say both of them bother.
Okay. So the in between the shoulder blades, part of what's happening is your head's going forward mm-hmm. from an injury. You have a whiplash, double whiplash, where your neck gets moved around. Typically, this is where the mobility and alignment that you're in before the accident determines where the force goes. Your neck is supposed to have a curve in it. Have you been told that?
Yeah.
So the curve in your neck allows the weight to be evenly distributed. And on this model, it does a pretty good job of showing how loose the upper neck is supposed to be. And actually, there isn't much range of motion mm-hmm. that comes from the lower segments. About 60% of the work of your neck is designed to happen at the top. So if before your accident, there wasn't much curve in your neck, and then you get whiplash with this alignment, all the stress typically goes in the lower neck. When the lower neck is under stress, the head goes farther forward to get pressure off of the sensitive structures. There's 2 structures in your spinal column that have feeling. I'm going to use the lower back just because it's a little bit easier to see and it's larger. So the joint is where the 2 bones connect. See where that looks like a handshake?
Yeah. Those
2 surfaces, that's where your range of motion comes from. So if there's crystals or plaque in there, you can't fully close the joint. Then there's the nerve, the hole that the nerve comes through on the side called the intervertebral foramen. Obviously you can see the disc has a vital role in supporting the size of that hole. So as the disc becomes more thin, that hole becomes more what we call stenotic or narrow. You get pressure on the nerve. That's why I was asking you earlier if there's anything going down your arms or legs, because that would indicate that you got pressure on this nerve. Local pain typically is just the joint. So we have the joint and these knuckles are under a lot of stress. That's postural. So the more forward the head goes, the more inflammation the joint is under. When you have an injury, a whiplash injury, you're going to injure these knuckles in the neck, and then your body's going to try to lean away from them by pushing your head forward. We need to understand and be clear that the creation of this was avoidance. It was to get away from something, and so the getting rid of it has the ability to, ow, Ed, and so we don't do it quickly. It's like more like orthodontistry. We move the teeth, but then it takes time for your body to acclimate and get used to it. But in just the sense of pain, having the hump in your upper back is a avoidance posture, if that makes sense.
Yeah.
It feels better. It's why all elderly people in America are rounded forward, and they feel better rounded forward. It isn't, they don't do it because they think it looks cool. It's an avoidance position based on the fact that the bone and the disc in the front have very little feeling. So our weight shifts forward, that puts a lot of weight on the disc, and that's what then leads to disc herniations. That then hits the nerve. You then have to go farther forward to avoid. This creates a positive feedback loop. I call it breaking the cycle a little bit. We have to go in there, rub it, and Ed, you're hurting me, it's sore. We got to make this tissue not need to be avoided. I want you to not heal in avoidance. So part of what I'm seeing is your body healed in the cocoon fetal position kind of thing. And a lot of the stretching that I'm going to show you at the end of our visit isn't very comfortable temporarily because we're going into the things that you run away from. But that's where I expect you want to live another 50 years, 60 years. And so we have to put you on a plan for longevity, not just temporarily how it feels. Like the dentist doesn't say, how do your teeth feel, and come back when your teeth hurt. It's not the best way to view the spine just based on feeling. On a scale of 1 to 10, how do your spine feel? What you can only tell me is two structures, the joint and the nerve. But we can have disc injury and not know about it. X-ray won't show it. So it's why I've sort of want to get more away from X-ray, MRI, especially in a car accident case where you have a double whiplash. You know, it's likely we have disc injury, and it's that disc injury that's causing the avoidance. You're good. So the center of your shoulder, this is what we're dealing with. If you look over here, your shoulder is about here, and your middle of your ear hole is about 1 inch, 2 inches forward from where your head should be back here. The avoidance is what's causing the rounding, and then this all fills up with fluid. All right, let me look at the rest of you. Nothing going down your legs, you said earlier, nothing? No. Okay, left hip is high, right? So when I see your hips, somebody might say, and maybe you've been told that a leg is short. Has anybody ever said that type of thing to you? No? Okay. Your left hip is high, so it gets very silly very quick. Okay. Somebody might say, oh, look at that, your left leg's short, but it's because your left hip is elevated. Okay. The left hip elevates, so just so you can see, this is what I felt on the left hip comes up to make the holes that the nerves go through on the right larger. Do you see that? So, Ed, I feel fine, but you're in avoidance, right? So you might have an injury over here. It's like, I feel great, doc. You know, I have no pain, but why are you tilting, right? So it's questionable. It leads me to suspect that there might be something in there that, Ed, my back was fine until you touched me. I know, but you were in avoidance. So as we start going back into the areas where there's something hidden, just want to make sure that we're on the same page.
Yes.
There's something probably, could be something in there. And the last time you were adjusted was how long ago?
About 3 years ago.
3 years ago.
3 years ago.
Okay. Take one deep breath in for me. And then head back for me. Let all the air out. Let all the air out. There you go. Let it go. Deep breath in for me. Just relax. I got you. I'm not going to hurt you. It's okay. Exhale for me. Let all the air out. Let it all go. Yeah, deep breath in. I'm sorry. Yeah, it's tight. Oh, boy. All right. Breathe in deep. Oh, wait. Exhale. Yeah. All right. Stay there. A lot of tightness in there. You okay?
Yep.
I'm sure that was tough. Try a twist. I got you. Left side for me, okay? I'm just going through your spine, seeing who's working. I'm just trying to assess, do you have the whole team working, or, Ed, I really didn't like that. It's not good. I'm asking you to bend your joints. Do you understand? If I ask you to bend your finger, it should do that. But if you bent your finger and you went, it's pretty good. No, it's supposed to do that. So that's what I sort of assessed on your back. I asked the joint to fully bend, and it gave me halfway. Well, Ed, that's normal. It's fine. It's always been that way. It's not the way it's always been. The joints used to move better than that. All right, deep breath in. Exhale for me. There we go. Rotate, exhale. Let's go face that for me. Okay. Yeah. SCM is just in a rock-solid spasm here. Okay. I'm just going to rub for a second. All right. Sometimes I'll adjust you cold. I'm not going to do that to you. I can feel the tension. I know it's not, I know it's probably not moving that great. Let me have your head. There we go. Let it go. I gotcha. I am letting it go, Ed.
I'm trying.
It's okay. I understand that there's something, like I said, there's injury in here that your body's guarding and protecting. You know, this is the whole goal of restoring the curve to your neck, means that your body doesn't need to guard it anymore. It puts it in a better, more stabilized position. It's not supposed to be ortho or straight. It's supposed to be lordotic, meaning arched and curved. The arch allows the weight to be evenly spread over all the segments. My favorite, when I say the word spread, I always think of a peanut butter and jelly sandwich. Nobody wants a peanut butter and jelly sandwich where it's all clumped up in one.
Yeah.
Right, all the peanut butter's in one section, all the jelly's in another section. You take a bite and you see all you get is bread. You know, so that's all I do for a living. You see, I take the peanut butter and I just spread it over the whole piece of bread. If you have all the work clumped up in one area, it's going to be rightfully so kind of mad. And that's what this is really just an avoidance that's grown, and now we have to... Nobody wants to do it because we live in a world where they train us to be your friend. I'm here to be your buddy. I'm your friend. You know, but a good physical trainer at your gym shouldn't be your friend.
Yep.
Right? They might be a little bit, little pushy, and you're hurting me. But they're going to get you better results than the person that's your friend. If this is really tight, then you can't actually rotate your neck because the main engine isn't running.
Yep.
And then what happens is you recruit your upper back to assist in cervical rotation. That's part of why your upper back is hurting, because you're actually utilizing your first thoracic vertebrae to assist in neck rotation. And you see people do this all the time, right? They'll look at me, they'll turn like that. See what I did?
Yeah.
I use my shoulders
Yes.
to help me turn my neck. And so you're recruiting. You should just be able to turn your neck without your shoulders having to turn. I've never been accused of going too easy. It's usually, it's also, I've never been accused of not talking enough. And, if you want me to be quiet, the visit costs double. And it's discounted if you let me talk. Okay. Okay. The entire visit, right, Ed? No talking? The entire visit.
That would be horrible.
How much extra is that? I'm teasing. All right, these are the roots of your neck here. There we go. And then the shoulder blade pain. So how much in here? Not too much in here?
No.
More up, just higher?
Yeah,
okay.
more higher.
So, okay, so just really just the attachments of the shoulder blades here. The joints in your lower neck will refer pain to between the shoulder blades. So sometimes it's hard for people to, you know, it's really not a shoulder blade problem, it's a neck problem that gives pain lower. But these are just the attachments. This is just from your head position. These are, you gotta push these down to allow your head to retract back. The goal of the adjustment is to not see how many pops I can get out of your spine. The goal is to loosen what's tight and to not loosen or not adjust what's loose. I think of the game Jenga as the perfect analogy. You're not trying to move every piece, right? A 2-year-old can knock the tower over. You're trying to move one block. And that's the whole goal, is to loosen what's tight, and which is really the upper neck. SCM's sternocleidomastoid was full spasm when you lay down. Okay, there you go. This is the curve. So at the end of your visit, we'll show you again. There's a piece of foam that emulates my hand and holds you in this curved position. We're going to start here. Real gentle here. I got your head. Real gentle. There we go. Let me hold your head. Relax here. There you go. You okay?
Yeah.
Yeah. You all right? Been a while. How'd that feel? You okay?
Felt great.
Yeah, you did great. Same thing. Here we go. On this side, let it go. There you go. Beautiful. I look at alignments for a living. That's all I do. I know where you like to do this. Your neck doesn't like to go over here. The eventual thing would be a disc injury on that right side. It'd be right hand numbness. That's why, again, but it's urine avoidance. This is what makes it tricky. And Ed, I was fine. No, actually you weren't.
Yeah.
You were in avoidance. And I don't live my life just teaching people to avoid their problems. I mean, it's just not a good way to... But I guess you can do that. You can try to make it. Good luck.
I'm curious to see what I look like when I get done.
Yeah. There's already some marks coming out.
Wow.
right there, all right on the. So the muscles produce lactic acid as their, I call it cellular exhaust. Like an engine produces an exhaust out the tailpipe. Not a Tesla, Ed. Okay, fine. Gee whiz. Somebody in the comments section is gonna. But my point is that there's an exhaust the muscles produce. When an area is very tight, it doesn't get good circulation, so that exhaust gets stuck in the tissue until somebody goes in there and rubs it, works blood in there, and releases it. There we go. There we go. Okay. So these are all the roots of your neck here. These are all the attachments here, so we want to push them back down. Even just laying face down on my table in a second, the table doesn't let your head go forward. So sometimes even laying face down on my table, this table's not very comfortable. Well, it's not letting you go into avoidance. And so it's part of my exam and test today is you surviving even face down on my table, right? It's like, usually I don't tell it to people, but that's part of your treatment is surviving. There we go. But yeah, these are, you can see how much these muscles are just tight here.
So I do see like a massage therapist at least like I try once a week, but probably once every 2 weeks for sure.
Okay.
And she tells me that I need to like put my head and hang off the side of my mattress.
Backwards? Okay. That's not a bad idea. That's good.
To learn to relax. So I'm not like always so tight.
So it's probably the safest way for a layperson that's not being adjusted actively to do. There are better ways to change posture than that, but it's a safe thing to give to a person that's not under my care. Mm-hmm. All right, just gently look up towards the ceiling. See how that's where her neck is bending. Go ahead and look straight forward now again. Right there. So above and below are restricted. This is where your neck is aging. The more forward the head goes, this all space is open. This is what then eventually gets infiltrated with fluid and fat, and that's what creates the puffiness in here. But it's ultimately because you've occupied a space, you've opened up a space and then your body filled it. Part of that fluid we can see right now as I'm working on you. We actually can see some of the inflammatory, some of it's just bruising that's in here. So an area below is tight, the area above is tight. So they're not getting good circulation as they should. I'm getting out of here. Kind of weird. Zoom in on that a little bit if you can see. There you go. I mean, that's what you're dealing with. What I was trying to say, see how that's the crease? Right below that. It's almost a line there. That's where all the bending is happening right here. Yeah. And it's tight above. And then down below this is tight. Mm-hmm. And we're going to work on it face down in a second, but that's what you have to do. All right. There's a little bit in here. These are just attachments here, but there's a couple little bumps in here. Feel them? That kind of, I think they're more injuries in the muscle, though. This should be smooth, no Belgian road. Should be as smooth as anything here. There shouldn't be. So the middle back restriction here then makes this area tight. The lower neck overworks. That creates the antalgia. So restoring the movement in here allows you to actually be upright. Okay. There you go, right there. You don't like it. It's way too tight. Here comes the rain, I guess. So yeah, this is that during that hug adjustment, I was checking the mobility of these joints, and I got about what I expected. That wasn't very pleasant, Ed. Yeah. That wasn't fun. If it was fun, I'd be confused. I'd be, how did this posture get here? I expected this to be immobilized. Did they just did face down adjustments on you? They didn't do the hug? I'm always just curious.
No, they just did face down.
Face down, okay. I just find it a little bit more difficult sometimes on the patient. Very smart. Now the rain's going to drown me out. I can't hear you anymore, Ed. You just need like an hour in here, and it gets pretty boring. And I just got to sit here and rub and clean all this. It's like scrubbing tile.
I'm sorry.
It's all door. Thanks for comparing my back to a grout in the shower. I'm sorry. I have no other analogy for you. It just needs time. You have to sit here and scrub this. I'm sure it's sore.
Are you doing okay?
You okay?
Yeah.
Yeah.
All right. This needs. Look at that knot right there. Wow. Boop, boop. It's got to get all out of there. Okay. All right. Okay, pretty sore?
Yeah,
Okay,
it's sore there.
Yeah, okay. These are the roots of your neck. Okay. I'll get you later for that, Ed. Mhm. I suppose they weren't going as hard as this, huh?
No.
Yeah, okay. No, Ed.
You're doing a pretty good job.
Okay. Just not sure if I like it. I know, we'll get it. All right, take a break. More forward, the tree goes the opposite side, the roots come out of the ground. It's just response to the posture. It's, cause effect. This is the effect as this happens. This is why this type of care isn't very popular. Because it causes confrontation. I want you to look at this. We have to go back into this. No, it's ridiculous. Too many chiropractors are singing the song, me and you and me, so happy together, Sorry. There's two ways through life, laughing or crying, okay? I've chose the laughing path. I've chosen the laughing path, and I think everybody's on the crying path. I'm sorry, I won't join you on the crying path. So you've never had the combing done before?
No.
Okay. All right. So as you progress with this type of care, the marks eventually never come out. As the tissue becomes cleaner, the mark is the evidence of what's trapped inside. I mean, this is like 1,000 years. Pretty old stuff here. Just combing the tissue, drawing blood into the tissue, takes the waste out, speeding up replacement. Just been around for a long time. Have they done imaging of the abdomen and your
Yes.
ovaries,
Okay.
and they said everything's okay?
Yes.
Okay. The instructions for how your ovaries work comes through the channels in here. So inflammation in here will cause sometimes dysfunction of the ovaries. Our world doesn't connect the dots that this area being congested and clogged and ovarian dysfunction is the same thing.
Okay.
And so the level of what I'm seeing in here, plus your history of having, breast issues, I'm just saying this, I would be curious, making sure you're checking, making sure the ovaries are okay.
Yeah. They put me, I'm in full menopause, so I don't know if that has something to do with it.
So hormonally, pills-wise, they've done that?
Yeah, through my cancer treatment.
Gotcha.
Yeah. Which my treatment wasn't as invasive as it could have been.
Okay.
I'm grateful.
Yeah, were they able to just do the surgery and radiation, or was it chemo as well?
So I did a test.
Okay.
And I did pill form. I did something called Vibrance.
Mm-hmm.
Yeah. My first I actually saw many doctors before I picked the right one, in my opinion. And the reason I chose that doctor was because she actually read through my file and not just said, oh, this is what the MRI is showing. You know, she paid attention to how, like, what came out of the samples and all that good stuff.
Okay.
And she was like, okay, this is the best route to go.
So were any of those pills chemical chemo? No? Or was there a chemical level of chemo?
Yes.
How long was that?
About 6 months.
Okay. You know, obviously they told you, that affects every tissue in your body.
Yes.
It isn't able to target just the area that they're trying to focus on it.
Yeah.
Every tissue in your body is affected, and so muscles, joints, everything.
Yeah, it was bad for a while for like joints and muscles.
Right.
Oh my gosh.
So how long have you been, so you're in remission, do they call it remissions? So how long have you been in remission?
So, in January, I get to be considered a survivor.
Oh, okay.
Excellent.
That's awesome. Yeah. I'm sure that was a scary journey.
It was extremely scary.
Sorry. It's like I got angel wings.
Is that right side? It was more on the right side than your left. But this is what both sides of these need to be cleaned out. This is all part of what you're avoiding.
Okay.
Breathe. All right. Okay. If the vertebrae are moving, the tissue self-cleans. So the tightness in the joint is part of what has to be addressed. That's what I'm trying to do right now, is try to restore some mobility. There we go. There we go. There we go. Right on that. There we go. You okay? Okay? All right. It's going to hold. So we're going to emulate what I'm doing right now on the floor in a minute. There's a yellow Denerol, I'll show you. Just going to try to emulate what I'm doing, holding pressure downwards on this upper back hump. And then we're going to have a neck Denerol also for your neck, but these two devices are what we're going to use to start putting pressure and molding. That's the joint we're trying to check on the side. There's a joint in there, largest joint. Natural births for your children, or was there C-sections, or?
Natural births.
Part of what I asked that is that this joint gets pretty traumatized in natural birth. So after natural birth, we want to make sure this joint doesn't lock up and, that makes sense, tighten itself as a result of the trauma of childbirth. Okay.
It definitely locked itself up.
Right. Well, right, because everybody's like, what the heck was that? Lock it down. So this is postpartum. They don't tell us to have this checked. Otherwise, these joints quit on you. And then that's another piece of the puzzle of why our posture shifts. We're losing members of our team. All right. Okay, all right. Okay, good. Okay. Little tiny toes. Don't make fun of my toes, Ed. Okay. There's nothing to grab onto. That's like tiny little toes. All right. Actually, there we go. There we go. Good. All right. Go ahead and tilt your head to the right for me a little bit. Tilt right. There, a little bit. Tilt your head to the right for me. Okay, good. Okay. That was interesting, Ed. Okay. Go ahead and tilt to your left for me. There you go. Good.
I felt that.
Go ahead and tilt to the left for me. Okay.
Okay.
That's the other chiropractor didn't do that. Okay. Okay. So you would place it, if you can see, kind of right above that hump a little bit. The idea is to have your arms up, and then you actually do a little bit of a downward push, kind of rub. So if this was the hump, you try to get above it and then push it kind of up onto the mountain of it. So we're going to start right up for Carlin to see. We're going to start right above it, and then we're going to do a tissue pull downwards right over it. So we're going to start right there. Lay back for me. Okay. Now bend the knees for me. Okay. So now bend the knees. Arms above your head. So we're going to do a little thing called a tissue pull. You okay?
Yeah,
You
this
okay?
is interesting.
Okay. All right. So we're going to push with your feet, and you're going to slide a little bit. You okay? All right. Stay right there. You okay?
Yeah.
You see what that? See how the tissue moves? So the idea is to make your contact. See if you can relax your arms there. If you can relax. Yeah, that left arm doesn't want to go back as far, does it? Mm-hmm. The idea is that makes sense. We had it right above it, and then we slid because the tissue can move right onto the peak of it.
Okay.
And it just takes time holding yourself in the opposite position of what you're used to.
Mm-hmm.
Okay? That's it. It's just everything I do on the table is to make it not so inflamed on the backside so that you can go deeper and deeper, and we actually start making it taller.
Okay.
So we have to eventually have these support blocks on it to, so you're ready for this? Not only do you start actually pushing this in, but you actually start taking the head and
Yeah.
pushing it back. So right now we're not doing the head component. That's what that head strap was for.
Okay.
Right now we're just doing sort of phase one, which is just seeing how upset you get with me with just putting some pressure and then holding it. So like when you were face down, I was pushing on it for 5, 15, 20 seconds. Now we're going to do like 20 minutes. It's like a tree leaning over. I just took it and held it here, and then it'll be more like in the middle, if that makes sense. So it's just, we call this mirror image stretching. They've done enough research in the 90s with physicists looked at the spine and showed that ligaments have to be stretched. It's actually the front side of your body that has been like fabric. It's all been wound up. Does that make sense?
Mm-hmm.
And so that's what holds you rounded forward. So even though you try to hold your body back, this tight ligament on the front. So it's about stretching the front side so that your body will want to just be upright. And there are posterior ligaments that have been all stretched out on the back, so they don't have the elasticity to pull you back upright. So it's actually, as you stretch more, and my ribs I'm feeling on my sternum, you'll feel this all opening up. That's part of why I have your arms to the side. I'm trying to open up the sternocostal joints.
I felt that right now.
Right, that's where, but do you see what I'm saying?
Yeah.
That this is because this has been compressed, and that all has to open up to allow your body to want to be upright. And many times people have ribs on their sternum start to ride up onto the sternum. That happens because of that constant forward rotation. It's the opposite of the hunch posture. This all pops open, this all compresses.
Okay.
Lay back on me when you're ready. Yep, there we go. I got you. Yep, you're good. You're good. So this is the neck one. This one I don't suspect will be very difficult today. You really should do a month of this before this guy actually is very effective.
Okay.
This, because of the misalignment, there's not much pressure on your neck right now because this is all hunched. So there's not much stretching going on in your neck. So I would really spend most of your time on this guy.
Okay.
I think we're probably gonna just whack you with this. There we go. But this, I wanted to give you a preview of what this looks like. If you find somebody in Tennessee or me later on, this is all of these pieces need to be utilized, but there's sort of a sequence on how to use them. Okay.
Okay.